Thank you, Mr. Chair. It is with great pleasure that we talk about the Waikato District Health Board and the way that Health Board has achieved so much under this national government through the leadership of the Honourable Tony Rowell and also Dr Coleman, who has also been very active in the health field and made a huge difference in promoting health decisions and effective results for our region. And when we look at some of the results that have come out of the Waikato region, and especially the Waikato District Health Board, the biggest thing that anyone that will go to the city will see is the massive change on the skyline as you see cranes operating on that health site. And there has been over $400 million expansion program and renovation program for the District Health Board in Hamilton. It is a huge program, seeing new ED departments that have just been a new ED department created. That's gone in line with the new maternity department there, and there's been a lot of work done on the wards and also in the theatres of that great institution. And the District Health Board has led in the way that it has delivered services to the community. And we see that in the way that there is probably an extra 50 doctors added to the health service and 250 extra nurses. And that is something that is being very, very much sought after across the country and especially in the Waikato. And we're delivering on access to elective surgery with an extra 3,674 people having elective surgery. And that's an extra 35 patients per week getting surgery done. So those are tremendous numbers. That makes a real difference to those people's lives and makes a difference to the effectiveness of their ability to contribute to our economy. There's better immunisation with an extra 868 two-year-olds fully immunised in Auckland under National during the 2009, and that representing part of that total of 5,053 two-year-olds immunised around the country, a record of 86%, something that previous governments would have been very jealous of. There are shorter stays in emergency departments, and that is something that I know the Waikato District Health Board has been very careful to make best use of their resources and trying to get the best results that they can in their emergency department. That is challenging in the Waikato because you have a lot of traffic injuries in that area as you have a lot of roads which connecting two of the big centres of Auckland and Tauranga, and so we deal with a lot of road trauma, and there's a special trauma department at the Waikato District Health Board that makes a very effective contribution to recovery for people that are in those kind of accidents and also industrial type accidents that you see in that region. Shorter waiting lists for cancer treatment, another thing that the Minister is being very careful to see some results in that regard, and we've seen that across the country, and it's good to see that happening in New Zealand with that horrible disease of cancer that nobody really knows what can be done, but we can do the best with our treatment and processes to enable the best for our patients in those areas. So there have been a number of very significant additions to the health sector in the last 3 years. The elective surgery numbers continue to rise, and that's something that the Minister has taken particular interest in, and seeing those number of patients rising in the ability to get that surgery. And the Waikato District Health Board has performed well over the time and done very well in its construction program of renovating the sector, especially in the Waikato. If you look at some of the quarter 3 results for 2010, 2011, and you look at the Waikato District Health Board, for example, in regard to diabetes and cardiovascular services, they rank 8 out of the DHBs. That's a good ranking, but something that they will want to improve on as well. But also they rank 16th in the better help for smokers to quit, and the increased immunisation, The Waikato District Health Board ranks as number 9.
Mr. Chair.
Honourable Jonathan Coleman.
Sorry, I'm not speaking.
You're false alarm. So no other members speaking. I'll put the question, and the question is that the report of the Health Committee on the 2019 financial year of the Waikato District Health Board be noted. Those of that opinion will say aye. Contrary, no. The ayes have it. The next entity I understand that members wish to debate is the Waitemata District